Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our special guest today is James LaValle, internationally recognized clinical pharmacist, best-selling author, and A4M faculty member. We'll be back with our interview after this brief message from our sponsor.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
Today we're so happy to have a fan favorite of A4M, Dr. Jim LaValle. Welcome. It's a pleasure to be speaking with you.
It's great to be here. I appreciate that comment. That's great.
Well, it's true, right?
Yeah.
So we're here at the 30th Annual A4M Spring Congress in Hollywood, Florida, and you are covering a lot. Would you mind just giving us a brief summary of some of the things you're covering?
You know, first of all, it's amazing that this is the 30th Annual Congress. I mean, that shows you that the desire and the need for us to learn about longevity and anti-aging and performance health is just growing. More and more healthcare providers want to be in it. And so for me, I'm pretty busy this weekend.
Yeah.
So I'm overseeing, as I'm the chair of the of our International Peptide Society, and the education that goes along with that. We're having our module on peptides. So I have top doctors who are clinicians who implement and utilize peptides as a part of their practice. I'm speaking with them as well. So I'm educating, but at the same time, organizing all these great docs to be able to provide information, and then being a part of that delivery, creating an experience for the learners so that they can actually get back on Monday and think about how they can apply that knowledge. So that's peptides, very exciting. Mm-hmm. And then of course in Module 1, I'm talking about the use of botanicals to help support menopause, andropause, thyroid support. That's in our module when we're really educating doctors about hormones, and really the capstone of what A4M was built on, of course, was educating doctors on hormones. Mm-hmm. And so I've got a course there that I'm teaching, another one on peptides and SARMs to introduce them to the concepts and the risks associated with peptide therapies and or selective androgen receptor modifiers. Next, doing a lot of teaching in which we like to think is the putting it all together module for our fellows. It's Module 5. Mm-hmm. And in Module 5, what we do is we really hone in this understanding of systems biology medicine, how all the networks of your body are connected and how they're communicating. And then not just the education of that, but providing the understanding of going through case studies. How do people progressively lose their way with their health? And then real world cases where we're going over them with the learners on what to do, how to assess, and once again, what are you going to do on Monday morning? So I'm teaching quite a few courses in that one. And then the last is, of course, the program with L-Nutra and on fasting and all of the information. I mean, I had the Joslin Center's head of diabetes research, Dr. Hamdi, sitting next to me in a panel discussion.
Wow.
Now, come on, that was thrilling for me to have an educator and researcher at that level coming to our event and actually creating very practical information that he was distilling out to everybody that was there during the conference. So to me, this was just an incredible, I think, diversity of what we're learning and what we're able to help students where their interests are at. So it's been a pretty amazing couple days already, to be honest with you.
And aren't you giving a lecture on 8 tips for longevity or something as well?
Oh yeah, there's that one too in the General Congress. I don't want to leave that out.
No, of course not.
Yeah, well, I mean, I think first of all, I'm obviously passionate about longevity the older I get. So, yeah, right. I'm turning 62 next month, so I've got to feel pretty, passionate about let's live longer. So it's a talk in the main Congress that's about, well, what are the key things you can think about as to how you can help yourself to not just live longer, but really think about how do I live healthier? Because in the end, what we really want is want to be as healthy as we can as long as we can, right? I mean, for me, that's what's driven my focus over the last 40 years of being in this work. So it's exciting. I forgot about that one. I'm glad you reminded me.
There's just too many to keep track of.
Yeah, exactly.
So is there anything else you'd like to share with our audience today? Any tips that they need to be aware of for longevity?
Well, it's the old saying of, watch the stress and make sure you get some sleep. But the more I continue to see research from my colleagues and when we were putting together our education processes, really understanding that, that stress response and how to look at that and being able to manage people's diurnal patterns of cortisol, helping them to get a good night's sleep. And yes, are they going to need hormones as they're aging? Are they going to need detoxification potentially? Do we need to do specialized labs for them too? Yeah, we do. But you know what? We also have to cover the bases for people and get those basic things. Don't forget about the basics. And that would be, what I'd share with the audience. Get to the next event. I mean, Las Vegas is coming. We've got more education on modules with peptides. We've got live demonstrations and applications in the areas of peptides. We're doing aesthetics today, in fact, and we'll be repeating that. And so, jump on in. The water's nice and cold, right? Let's get learning and continuing your experience. If you've been at A4M before, but it's been a few years, you know what? We're evolving and creating new information every session. So I really encourage people to continue that quest for new information, and we're going to be the best source for it.
Absolutely, and it's our 30th year and we're so excited. And it's actually going to be a celebration in Las Vegas this December called Longevity Fest. So that's exciting. Don't forget to rate, subscribe, and review us. Leave us a 5-star review. And thank you so much for joining us today. It's been such a pleasure.
It was my pleasure.
Out of your busy schedule.
Well, it better be at least a 5-star review. Can they add another star because I'm with you?
Yeah,
I mean,
maybe
what's going
6
on
stars,
here?
exactly.
Yeah, let's keep going.
Thank you so much.
Sure.